I've heard you say time and time again that the veterans should be receiving the care that they have earned. Yeah, they deserve it, but they have earned. This is a contractual agreement. When they want it, where they want it. But then you sit there and oppose the very legislation that is going to help us deliver it. One of President Trump's achievements was the passage of the VA Mission Act. The legislation gave veterans a true choice by establishing a permanent program to provide hospital care, medical services, and extended care services to veterans through the non-VA healthcare providers. The Mission Act is necessary as many rural veterans live hundreds of miles from VA facilities, and others must wait months to get the care at VA facilities. Our country owes a debt of gratitude to our nation's veterans, and the least we can do is have a health care system that provides access, and I will say, when they want it, where they want it. The Biden administration has been trying to kill the VA Mission Act by not paying providers in a timely fashion, forcing them to drop out of the program, canceling veterans' appointments, and denying community care referrals, waiving wait time access standards, and not even informing veterans about the community care program. The problem is that if the criteria for allowing veterans to easily access community care is not codified, you say you need that flexibility. But the problem is that if it is not codified, the VA has already demonstrated their ability and their desire to deny that coverage. You've been very misleading about making sure that the veterans can access it. Ms. Peabody, the VA opposes the Veterans Health Care Freedom Act, correct?
Correct, sir.
Why should veterans not be able to choose where they receive their health care?
Thank you for that question. VA is supportive of veterans being able to provide input into where they get who their provider is.
Where they want it, when they want it. That was your words. That's the words I've been using for the last 4 years as I've sat on this committee. Where they want it, when they want it. Why should veterans not be able to choose where they receive their health care?
Thank you for that question.
So do they have the ability, as you say, to choose where they want their health care, when they want their health care, or do they not?
So my words were where they need it, when they need it.
Oh, so you know better what they actually need than the veteran themselves. Let me tell you, in an urban area, in an urban setting, it is very easy for the veterans to travel to a VA facility. Very easy. But in states like Montana that take 12 hours to drive across the state, it just doesn't make sense, not financially or from a delivery standpoint, to try and build the VA facilities around the state that are going to give that same type of access, okay, to the veterans that are in the rural communities that they have in the urban areas. They are not going to have that. So they should be able to access that health care in their own community. And you don't know better than that veteran. You don't know better than that veteran. They know what they need, and they know when they need it. Yes or no, do you think the VA is more equipped to choose where a veteran receives the health care than the veteran themselves?
Thank you for that question. It's very important that a clinician is able to determine that there is a clinical need for the care, but absolutely in compliance with the Mission Act, we will, if a veteran would like to get their care through the community, we will assess based on the eligibility criteria, including the access standards.
Well, again, what we have seen, this committee and the community of medical providers, is that the Veterans Administration has the desire and the ability to deny that coverage and to keep the veterans from accessing their health care when they want it, where they want it, in an attempt to try and drive all of the veteran care to the VA facilities, and that is not in the veterans' best interest.